Welcome to The Explainer. Today, we are diving into something really fascinating, the incredible, powerful connection between the words a doctor uses and a patient's actual ability to heal. And trust me, this link goes so much deeper than you might think. So let's just jump right in with the core idea. You know, we usually think of medicine as prescriptions, surgeries, things like that. But what if one of the most powerful tools in a doctor's entire kit wasn't a scalpel or a pill, but something we all use every single day? I mean, really think about this question. What if the right words could calm a patient's fears right before surgery? Or what if a really clear explanation could empower someone to actually stick with a tough treatment plan? That's the kind of power we're talking about here. Language that's not just communicating, but actively shaping the journey to getting well. And yeah, there's a name for this. It's called therapeutic communication. And this isn't just about, being polite. It's about using language like a precision instrument, a clinical tool that can be every bit as impactful as a prescription. This is really where medical science and human connection come together. Now, I know what you might be thinking. This all sounds nice, but is it real? Well, this is not just some feel-good idea. Let's get into the hard science and look at the solid evidence that actually backs all of this up. And the research here is crystal clear. Just think it through logically. When a patient feels like they're actually being listened to, their anxiety levels drop. When they trust their doctor, they are way more likely to follow the care plan. All of this creates this sort of emotional safety net that is absolutely crucial for physical recovery. And it all adds up to one thing: better actual health outcomes. This quote from a study just says it perfectly. Language isn't just a tool to figure out what's wrong, it's a massive part of making it right. Okay, so we've established the why. Now for the how. How does this actually work in a chaotic hospital or a busy clinic? Well, let's break it down into 3 core principles that can totally transform any conversation in healthcare. The way to think about these is like an essential toolkit for communication. Inside, you've got active listening, empathy and compassion, and a real commitment to choosing clarity over complexity. So let's open up this toolkit and look at each one. First up, active listening. And look, this is so much more than just hearing the words someone is saying. It's about tuning into the whole unspoken story. The hesitation in their voice, their body language, the emotion hiding behind the words. It's really about understanding the person, not just the medical problem. Next in the kit is empathy. This isn't just feeling sorry for someone. It's about trying to step into their world for a moment. It's that ability for a doctor to look at a terrified patient and say, "I get it. I can see this is scary for you, and we're going to get through this together." That one simple moment of connection can change everything. And the third tool is clarity. This slide just says it all, doesn't it? For a doctor, myocardial infarction is precise and correct. But for a patient, it's just scary, confusing jargon. But heart attack? Now that's something they can understand, process, and act on. Using simple language isn't dumbing things down. It's about opening the doors so the patient can be a real partner in their own care. So we've got the principles, but how do we actually put them to work? How do healthcare providers bridge the communication gaps that, let's be honest, definitely exist? Let's look at 4 really concrete strategies. And these strategies really build on each other. It has to start with training, treating communication not like some fluffy, soft skill, but as a core clinical competency, just like learning to read an X-ray. Then it's about using tools, like a simple drawing to explain a complex procedure. It's also about being culturally sensitive, because a person's background deeply shapes how they view health and medicine. And finally, it's about using technology, not to replace us, but to help us, keeping that conversation going long after an appointment ends. Okay, let's see what this looks like in the real world. Picture a nurse who takes just 5 extra minutes to really listen to a patient's fears before an operation. That small moment of empathy can literally lower the patient's blood pressure. And the result? They're calmer, more cooperative after surgery, and the recovery is actually smoother. That's a straight line from empathy to a better outcome. Or how about this one? A cardiologist is trying to explain a tricky diagnosis. Instead of using a bunch of medical terms, they use a simple analogy. Think of your arteries like the roads in a city, and right now there's a big traffic jam. All of a sudden, you can see the light bulb go on for the patient. They get it. And that understanding is incredibly empowering. It makes them part of the solution. And what about tech? I know, it can sometimes feel like it's putting a wall between people, but it can also be a bridge. A simple online portal that lets patients ask quick questions and get clear updates can make a world of difference. Instead of feeling alone and disconnected between appointments, they feel engaged and like a true member of their own care team. So when you boil it all down, what's the ultimate takeaway here? What is the one big idea that ties all of this together? It's this really powerful idea. Communication is not a nice to have. It is not secondary to a doctor's clinical skill. It is the very foundation of healing. A surgeon can have the steadiest hands on the planet, but if they can't build trust and understanding with their patient, that foundation for recovery is shaky at best. And we're going to leave you with this final thought, which just perfectly captures everything we've talked about. Before any medicine is given, before any procedure begins, true healing starts with the simple, profound act of being heard. Welcome to The Explainer. Today, we